and I'm a child life specialist here in the ER today. How are you doing today?
Good, thanks.
Good. How are you doing? Okay. What's your name?
Jane.
Jane, it's nice to meet you. Can I have a seat here? Yeah. Who do you have with you today, Jane? Grandma. Is it okay if I call you Grandma?
Sure.
Okay. All right. What are we in for today?
Sick.
You're not feeling so great? All right. Well, I'm here today to kind of talk you through some things that are going to happen later on. You're going to be getting an IV, and I'm going to help you learn some things that will make that go a little smoother. Okay? I'm going to help Grandma help you through the IV process. Okay? How does that sound? And I'm here to make sure that both of you understand exactly what's going on, and here to just be an advocate for Jane. Okay? Does that sound okay? Can I hang out for a little bit and talk? Okay, well first, have you ever been in the hospital before? Yeah, I was looking back. It looks like we were here about a year ago. What for?
Fell.
You fell? Had to get some stitches? Yeah. Okay, Grandma, were you present when she got those stitches last time?
Yeah.
Yeah, okay. How did she handle that? Was she very upset? Did she want to look towards it or look away?
No, she looked away.
She looked away, and that seemed to help her cope a little better.
Mm-hmm.
Now, were you in the room with her?
Yeah.
Yeah. Did that seem to calm her down when you were there?
I think so.
Okay, that's good to know. That kind of helps us assess how we can prep you guys for the IV start, just knowing the past. Okay? Well, the good news is we're not getting any stitches today. Okay? Alright, do you know what an IV is? No? Okay, well I'm going to show you some pictures so you know what to look forward to, okay? Alright, so the reason we get an IV is so that they can give you medicine that's going to make you feel better so that we can get you home sooner. Okay? And I think we can both agree, all three agree, that that's something that we want, right? Yeah. Okay. Well, here I'm going to show you just, here I can show you both of you actually, some pictures just of the steps of what an IV is going to look like, okay? So first what they're going to do is they're going to choose a place on your arm, either here or here, or the tops of your hands. More than likely it'll be on one of these areas. And once they choose which one's best, they are going to clean the area really well, okay, with some alcohol swabs and some soap and stuff so there's no more germs, okay? And then you see this picture right here of this rubber band? It's a big bright blue rubber band that they're going to put around your arm right about here, okay? And it's going to be a little snug, kind of like if you tie like something too tight, or if you have a really tight rubber band on your arm, like a hair tie or something, okay? And it's going to be up here, and that's just going to help them be able to access this vein a little better, okay? Do you know what your vein is? No? Okay. You see right here, you see this blue part? That's a vein, and that's where they have to put the IV to put the medicine in you. Okay, so that's what they're looking for when they're going to look at both of your arms to see which one works better, okay? So once they've decided that, you see this little picture of this little tiny needle here? Okay. They are going to take that and they're going to put it in the vein, whichever one they choose. Some of my friends tell me it feels like a little sting, and then the pain goes away. Okay? But once they get that in there, they're going to pull the needle part out. So this part right here comes out. It's just this little tube part that stays in your arm, okay? And they're going to tape that down, throw the needle in the trash, and then they use that little tube, and that's what they put the medicine in with, okay? Okay, you see my friend here now has it taped onto her arm, and you see this IV pole, which is what you have behind you. That's where they hang the medicine, and then it'll go through all these little tubes into your body to make you feel better. Okay? Does that make sense? Do you have any questions about it? Okay. Well, if you have any questions throughout the time that I'm here, feel free to ask, okay? Or if you want to ask Grandma after I leave, Grandma can come and ask me too, okay? Alright, so now that we kind of know what an IV is and what it's used for, now we know that it's used to make us feel better, right? Now I'm going to show you and Grandma a couple things that we call positioning for comfort. And Grandma, this has a lot to do with you involved. As long as you feel comfortable, we find it works a lot better if it's a parent or a close relative like a grandmother that's doing this with the child. If something arises and you don't feel comfortable, one of us child life specialists can step in. But we're going to kind of prep you and teach you about these positions, okay?
Okay.
So there's 3 positions here. This one, straddle school age. This one's back to front school age, and this one's side sitting. Okay, and for her, what you've told me, her not wanting to look and wanting to look away, I think these 2 options are the best. So do you think either one of these would work best?
Probably the straddle school age.
Okay. Okay, that's kind of what I was thinking too. Do you see this picture, Jane? Okay, so I'm going to show you with my little friend here what that is going to look like when you and Grandma are doing it together, okay? So this is my friend Rex. He likes to come and help me teach my friends about stuff, okay? So, what you're going to do is Grandma's either going to sit on the side of the bed or in a chair, and you're going to sit chest to chest with Grandma, okay? Like you're giving her a big hug, okay? Have you ever sat on Grandma's lap and gave her a big hug like that? Yeah, it makes you feel better sometimes, doesn't it? Okay, well that's the idea here. Okay, so whichever arm they choose, we'll keep that arm loose. The other one will kind of have tucked under your arm that wraps around her. And this way, she can turn her head this way, because this is the arm we're using the IV, and since we decided, you think it'll be best if we don't watch the IV? Yeah? Okay, I think that seems like what's going to work best for you, okay? So that way you'll look this way, and I'll be standing over here, okay? And the nurse will be over here prepping your IV like the steps that we talked about earlier, okay? And what we're going to do is you have a couple options. While Grandma's holding you like this, feel free to hug her tight if you're nervous or scared, or if it hurts, okay? Or if you just want to hug her, okay? That's what it's there for, okay? So just, you can hug her tight. And Grandma, with your other hand, you're just going to kind of hold steady this arm that they're doing the IV with.
Okay.
Just to kind of help the nurse out a little bit, so if she starts moving, because she's just got a flailing arm, then you just hold it down. So, sometimes that happens, right? So, on this side, I'm going to be standing, and I've got 3 options for you. We can either read a book, blow some bubbles, or sing a song. Which one sounds like it will make you feel better?
Sing a song.
Sing a song, okay? Do you have a song in mind?
Mary Had a Little Lamb.
Do you like to sing that song when you're at home? Yeah, do you like to sing a lot when you're at home? Yeah, me too. Okay, so what we'll do is, I'll stand over there with you, and you can look at me, and we can sing Mary Had a Little Lamb. And just keep singing. We can sing lots of other songs, and just so you don't have to watch when they're doing the IV, okay? All right, do you have any questions? Do you think this is going to work out for you? Do you feel comfortable with it, Grandma? You think it's going to be best for her?
Yeah, sounds
Okay.
good.
Good, okay. So, I'm going to leave my doll, Rex, here to hang out with you for a little bit, okay? You and Grandma. And so that way you can practice your coping tools, your positioning for comfort. You can do it on your lap, Jane, so you know what you're to expect. You can have Grandma do it on her lap, so she's practiced a little bit. And then you can even practice you getting on Grandma's lap before it's actually time to do the IV. Okay? So I'll be back in about 15 minutes with the nurse to start the IV. Okay? Do you have any questions at all? No? Okay. Well, if you do, just let me know, and I'll be back in 15 minutes, and I'll leave Rex here, and you can practice with him, okay? All right. All right. guys. I'll be back.